I'm sure you've heard a lot of things about borderline personality disorder, but what is it really? The short of it is that it's a personality disorder characterized by severe mood swings, impulsive behavior, and difficulty forming stable personal relationships. Do you think you know someone that has borderline personality disorder? Well, you must have at least 5 of these. Here's 11 symptoms of borderline personality disorder: poor self image, trouble making concrete decisions, impulsive and self damaging behaviors, intense and quickly changing moods, feelings of emptiness, paranoid thoughts, disassociating, abandonment issues, unstable relationships, anger management problems, and misinterpreting facial expressions. There's an unstable sense of self when it comes to borderline personality disorder. Poor self image. People with BDP have a poor self image. It may fluctuate from having very high self confidence, and then it could be followed by feeling very low about themselves. They have a hard time making concrete decisions. They have a hard time making plans and following through. Some friends might call them flaky. They may not be able to work a normal job, and they just may be all over the place. They tend to let their emotions or circumstances determine their course in life because it's very difficult to stick with the goal till its completion. They're impulsive and self damaging. They have impulsive and self damaging behaviors. These dangerous behaviors are very common with BDP. The person with this disorder might drive recklessly, go on wild spending sprees, have unprotected sex, abuse drugs or alcohol. They might binge eat or impulsively take part in any other dangerous behaviors, whatever you can think of. They may also threaten, attempt suicide, or engage in self harm. Intense and quickly changing moods. Unlike familiar mood disorders such as bipolar or schizoaffective, borderline personality disorder features intense moods that nearly always change in a few days and even hours. Many people with BDP also suffer from anxiety, depression, or both. They tend to feel empty. It's just this pervasive feeling of emptiness that they can't seem to fulfill, which is why they have all those risk taking behaviors, because that's what they're trying to do. They have paranoid thoughts, especially when stressed. Paranoia can be a problem. It's typically very bad when they're stressed out, but their poor self esteem and interpersonal problems will make the stress worse. Negative emotions where others don't. The person they're interacting with may not be expressing any emotion at all, but people with BDP tends to see sadness, disgust, anger, or fear when they look at another person's face. This almost invariably leads to further interpersonal problems because they base their behaviors on faulty interpretations. If you or someone you know has at least 5 of these symptoms, feel free to call 211 to find a mental health provider in your area. If you need help finding someone, please feel free to email hello@yearofyushima.net. Feel free to visit my website, yearofyushima.net, for self-help resources. Thank you. Until next time, be safe, be happy, be healthy, and be whole.